I am here today to work on sharing today's message. It won't take very, very long, but it's an important topic for everyone to hear. So when you hear it, if it resonates with you, please go ahead and share. I was hopeful for my other better camera to be working, but we're going to work off the laptop camera today because that's working. It looks like the microphone is working. So if when you come on, you can verify that for me, that'd be awesome. I am going to get this shared in the Facebook group. So bear with me for just a moment. This is day 7 already. Yesterday's video I did while driving. So if you weren't able to tune into the Zoom, I just posted that recording today, and I want you to go ahead and watch it and post on their hashtag replay. And anybody who does that today, I will put in the name wheel and you will receive the gift that I mentioned in yesterday's talk. Just a couple more minutes to see if they want to come in and participate live. Today's gift is going to be a supplement treat that I enjoy on a regular basis called Fizz Sticks from Fizz, Fizz sticks from Arbonne, and it's the coveted blackberry flavor. So I have a whole box of those, and this is, if you know, this is a pretty pretty great gift. So what it is they're little individual servings that you would put in 16 to 20 ounces of water. They do fizz up a little bit, so you don't really need to shake it. You just need to have enough room for them to fizz. And they've got B vitamins in it, ginseng for energy, and very few calories. So yeah, the Arbonne Blackberry Fizz Sticks is the gift of the day. So I am hoping now that we can have the Facebook Live up and going, we can have this connected and be able to share a little bit of information. So today's topic is, what is functional medicine? I have had that question come up recently. I went to a networking event with women in entrepreneurship in Manhattan, and it was a wonderful evening with professional businesswomen who are in the process of designing, creating, or promoting their businesses. And so it was a really fun event. But a lot of the folks, their question was, well, what is functional medicine? I've heard of it, but I don't know what it is. So I'm going to talk about that today. So I want to pull up a couple little things that I can share and try to give you a little bit more information on it. So let me go to ifm.org. That is who I'm getting my training through. I have all of the modules done and all of the trainings done. Now I am ready to sit for my certification exam. So for me, I am trained in family medicine through residency in Kansas City at Research Family Medicine. I am certified in integrative medicine through Dr. Andrew Weil's program down at the University of Arizona College of Integrative Medicine. And I have taken all of the modules for the Institute for Functional Medicine and am just biding my time and waiting for the money to sit for the exam for the certification in functional medicine. So it does come with a lot of education. So when people ask, well, why does functional medicine cost so much? It's because we spend tens of thousands of dollars on additional education on top of our medical school education. And it's not just the dollar thing, it's the value, it's the knowledge, it is the skill to interpret and tease apart problems. And I don't know why I can't get this logged in. but there's a lot more to it than just saying I do functional medicine. It's not just a claim. It's not just a fad for me. It's not just something that sounds good because other people are doing it. This is my life. This is my purpose work. This is what I believe the future of medicine should be. And I do get so excited that there are plenty of folks interested now, and that there are other practitioners that are dipping their toe in the water or diving full head on and taking the plunge into functional medicine. So I invite anybody who has questions about it to talk to me. I'm very, very, very happy to talk about it. So let me pull up my little pictogram that I like to use, and I edit it just a touch because I think of it in just a little bit different, just a touch different, not a lot. So let me pull up our little tree. I want to see if I can get the whole thing for us here. So there we go. So let me share my screen. All right. So what you should see now is this picture of a tree. Okay. So functional medicine, this is the Institute for Functional Medicine. I do like the tree. The tree of life is kind of my symbol in the office, if you've seen it. I will describe it the way they have detailed it here, but I'll also kind of give it to you in the way that I describe things without a picture. So if you want to look at the top of the tree here, traditional medicine works from this node up. And they're more focused on the leaves and the fruits and the flowers. They're not so much worried about how those leaves and fruits and flowers look pretty, but they work on those. So typically people do not seek help until they have signs and symptoms of illness or dysfunction in the body. And that can be anything from aches and pains to headaches, discomfort, rashes, to full on organ failure. You know, it just depends on how disconnected one might be from the body or how much in denial they are that there's a problem. So again, traditional medicine, they love to specialize. You have neurology, gastroenterology, endocrinology, cardiology, pulmonology, urology, hepatology, immunology, all of it. Great. And there's a whole bunch of ologists that are not mentioned here. And unfortunately, when the traditional medicine system gets involved, and if any of you have had to participate in traditional medicine care lately, you probably get this more than others who've not been ill, that if you try to talk to the neurologist about a kidney problem, they're going to look at you like, talk to somebody else. I don't know. They aren't even going to be giving you the time of day to entertain the discussion on could something be related. You are not going to get your orthopedic surgeon to manage your blood pressure, and you wouldn't want to. You're not going to get your cardiologist to manage your skin condition. You're not going to get your endocrinologist. Unfortunately, endocrinology and immunology, they of all of them should be looking at the whole picture. And their endocrinology, I'm not going to alienate any one particular specialty here, but there are two movements right now in endocrinology, the ones who are traditional, where the numbers run the show, and then there are those that are doing the deep dive in how environmental toxins and factors are influencing the endocrinology of the hormones in the body. And so that one is getting traction, and I really appreciate that. The immunology, again, you have the old school, it's not an allergy unless it's an IgE allergy and you've had anaphylaxis and it doesn't exist in any other form. And then there are those that understand that we need to look at the entire immune system as a whole and how it interacts with its complete environment.
Okay,
So
I'm
again,
not
I digress a bit, but this is where traditional medicine works. Functional medicine works here in order to influence this to create optimal fruit and leaves and flowers.
I'm listening to
Okay.
Dr. Reagan.
So when we do your deep dive and we do your review and we ask about your childhood, we ask about your family history, we ask about your toxic exposures, we ask about your job satisfaction, we talk about relationship with your family, we talk about your sex life, your sleep, your food. There's a reason to it. And it is because this is where we can make changes to impact how your body functions, which is these things. It's assimilation, defense and repair, energy, biotransformation, and elimination, communication, transport, and structural integrity. To put that into layman's terms, it's how your body works. We want to create the optimal soil. We want the fertile soil to create healthy roots in order to allow all of those things to be taken up through those little vessels in the trunk, which is your body, your lymphatics, your blood vessels, your nerves, your interstitial fluid. All of that has to be working synergistically with your inner environment and your outer environment in order to have optimal functioning to create the healthiest version of you that we can. The other thing that I really, really, really love about functional medicine is that it's different. This is a contrast between the way we're taught in medical school and traditional medical training and how functional medicine approaches things. For instance, when I started medical school, we were provided the opportunity to sign up for the American Medical Association, and their gift to us was the physician's desk reference, which is a giant drug book. We weren't welcomed in with a gym membership. We weren't welcomed in with a meditation practice. We weren't welcomed in with a camaraderie group commiseration purpose. We were welcomed in with a drug book. When we studied our systems education, I went to an excellent school that was ahead of their time doing systems training. They called it the Genesis program, I believe. And we learned all of the sciences around a body system instead of going to chemistry, genetics, biochem, microbiology individually. We studied the musculoskeletal system, and we got all of the science around the system. So we got hands-on, firsthand, how they interplayed with each other, which was foundational to an excellent medical education. And it was groundbreaking at the time that we were going through school. And now you'll find most of the medical schools teach that way. That wasn't that long ago. It was 2008, but now it seems like forever ago. But despite the advances in their teaching and being in an osteopathic school where they teach the AT Stills, my favorite phrase of his is the body has a remarkable capacity to heal itself if given the proper support. That's the osteopathic foundation. Our lecture notes, however, told the medical school, medical system story. The first slide, after they gave us our objectives, it said, in addition to proper lifestyle and diet recommendations, blah, blah, blah. And all of these other things tend to be which drug, which procedure, and how to further work it up. We really didn't get great education on lifestyle and diet, even though that was instructed to be the first interventions that we made. So traditional medicine education recognizes that those are important, but they don't teach how to do it. We had a nutrition course that was 14 credit hours, online, group study, group test. We really didn't study nutrition. I was fortunate enough to have had a couple of nutrition classes as a nurse when I was in nursing school. Not everybody goes through nursing school to get to medical school. That's my path though. And then I was blessed beyond measure to get into my family medicine residency where at Goppert Trinity Family Care, that's where we did our clinic residency training. We were able to join a 2-year integrative medicine fellowship at the same time. So I started implementing this during residency and had been curious about it during medical school. So I've had exposure to it for many, many years. And as a nurse, I had learned that the folks who seemed to do the best or tolerated change the most gracefully were those who were practicing functional medicine type or integrative medicine type practices. So long and short, I don't diverge too much from the description here of the tree. So I tell you to look at yourself as the tree. Your body is the trunk. Your expression of health or illness are your leaves, flowers, and fruits. And your roots are where you came from and what you are bathing your body in. So if you were to ask me in a 30-second speech, what is functional medicine? I would say it is root cause medicine that addresses the cause of disease in order to turn back the clock to create health and wellness using lifestyle intervention, food, medicine, and social biome while teaching lifestyle modifications to create the optimum you. So that is what functional medicine is. That is hopefully clear. And if you are unsure, please, please, please don't hesitate to ask. I will try here to find, I lost it. I was trying to see if anybody had commented on the Facebook feed. And I don't think it's there for me to see anymore. But anyway, so that is what we're talking about today. So I see one person on live with me here, and I do believe that there are maybe 1 or 2 watching on Facebook. So I will ask if you would comment now in the Facebook feed, and I will put anybody who's watching and those here into the name spinner. Let me see if I can find our Facebook friends again. Oh, there it is. That's why we couldn't find it. Let me shrink that down. Let's go back here on Facebook. I'm looking sideways, so you're not getting the most attractive look at me. So let me pull this forward over here. Let's see if anybody is there. Okay. So I don't see any comments, but I do see a couple people watching. So if you could just type replay in the comments so I can see that and I know who's with us, that would be awesome. And there's a little bit of a delay, so I will give you a couple seconds to do that. All right. Well, we will see who all mentions the replay today, and I will be in touch and post the receivers of the Arbonne fish sticks today. All right, so we'll have a response for the Ganoderma mushroom capsules from yesterday, and then the fish sticks from today. So please comment if you have any questions, please post them here, and I would be so happy to answer them for you. And you guys have a wonderful day. Happy weekend.